first objective is what is erectile dysfunction, and we will see the some drugs that can induce the male erectile dysfunction. Erectile dysfunction or impotence is defined as the inability of male to attain and maintain erection of the penis sufficient to permit satisfactory sexual intercourse. Most of the drugs are reported to have drug-induced erectile dysfunction, and these drugs are when the patient's on chronic therapy. Examples are here. Some classes are mentioned here. These classes may induce erectile dysfunction if the patient take these drugs for the long period of time. The first class is diuretics. Thiazide diuretics or spironolactone. These diuretics are generally used in the treatment of or management of hypertension and also heart failure and some edema conditions. Then some sympathomimetics drugs, methyl dopa, clonidine. These drugs are also used in the management of the hypertension. Beta blockers, propranolol, atenolol, metoprolol, pindolol, timolol. If the patient take this drug for the chronic cardiovascular conditions for long period of time, that may develop erectile dysfunction. Antipsychotic drugs is psychosis is also chronic therapy. From the category of the phenothiazine may leads to the impotence. Anxiolytic drugs, also chronic drug therapy. Barbiturates and the benzodiazepines are responsible for the impotence. Direct vasodilator hydralazine is also used for the management of the blood pressure and the some cardiovascular related conditions. And anticonvulsant drugs, the drugs that are used in the management of epilepsy, carbamazepine and the phenytoin. The long-term use of these medications were reported to have the impotence or erectile dysfunction. In addition to this, some miscellaneous category of the drug, cimetidine, or we can say ranitidine. These drugs also have reported the impotence. These drugs are used for the dysphagia, cimetidine, ranitidine. These drugs are used for the dysphagia or some gastrointestinal related hyperacidity. Calcium channel blockers are also used in the management of the hypertension, blood pressure, and also management of some cardiovascular related conditions, nifedipine and the verapamil. So these all classes are generally used for the long-term therapy, and the long-term therapy leads to the adverse effect, and the adverse effect, or we can say the secondary effects, and the secondary effects includes the erectile dysfunction.